At about 6 weeks after surgery, our standard second postoperative visit happens here at this office. By now, your most common consistent discomfort about your surgical hip is what I call startup pain. When you get up, the first few steps hurt right over the surgery site. You take a few more steps and that kind of calms down somewhat. That's quite common, and in fact that's going to linger for a while. That's the surgical tissues being stressed and healing, and it should be expected. Even 6 weeks from now or 3 months from surgery, you'll still have that to some degree. Most people still need a cane at 6 weeks. Some few don't. Generally, the smaller or more petite the person, the quicker they'll get off the cane, and it has to do with the amount of muscle strength it takes to balance a smaller frame versus a larger frame. So my smaller people tend to be able to get off the cane more quickly, although not always. There's other factors that can play into whether or not you need a walking aid. And my very large patients often will need the walking aid longer. So again, don't be in a hurry to get off the cane. Generally at the 6 weeks visit, it's mostly a check on your visit. There's not a whole lot that we do differently. You still want to limit your sitting to about an hour at the most. People often start to ask me whether they're ready to return to work. And basically at 6 weeks, if you've come this far and you have a relatively not physically demanding job, then we could consider perhaps going back to work. I usually tell people before surgery to expect a 3-month time period before they return to work, and in general that's a good idea. But if you're in a hurry to go back to work and you're absolutely convinced that you'd have no trouble returning to work, then talk with me, and certainly many patients have gone back at this point or even sooner. Patients often who work for themselves tend to push themselves back to work too soon. Be careful, there's no reason to hurt yourself. But generally at 6 weeks, the worst would happen is you just make yourself unnecessarily sore. Again, you still need to avoid prolonged sitting. Hopefully by now you're taking nothing by prescription for pain. There may be some unusual situations where prescription pain medication is still required, but you may be getting by with either nothing or perhaps some Tylenol or over-the-counter pain medications like Advil or Relief. So again, call me if you have any trouble, and we'll rendezvous again at about the 3-month after surgery landmark. At 3 months after hip replacement surgery, you're about 75% of the way recovered. You have that familiar startup pain. The first few steps you take are a little bit more sore than subsequent steps, but you're probably doing quite well. You may or may not be using the cane full time, but that will continue to improve. At this point, most people return to work unless you have an occupation which, for some reason or another, makes it impossible for you at this point. It's important to think about long-term limitations after a joint replacement surgery. After hip replacement surgery, most activities are fair game. People work on a hip replacement, they're active. You're free to cycle and Nordic track and swim and hike. People farm on these hips, so they climb, they lift, they kneel. There's no lifting restriction apart from common sense. The only thing I would try to keep you away from is impact activities, such as jumping, pivoting, twisting, turning sports, racquetball, tennis, basketball. That seems to be a bit high-end if you want your hip replacement to last a long time. Some hip replacement surgeons don't place any restrictions on their patients, and that isn't because they have a different implant or a different technique than me, but just because everybody has different thresholds of risk they're willing to take. So just realize that the heavy pounding activities are asking a lot of an artificial hip, and if you're young and active and you want that hip to last a long time, we want to be cautious about such things. If you have further questions, don't hesitate to call me. At this point, I doubt that you'll need any further therapy. The remainder of your recovery is going to happen like the grass growing or like coasting downhill. It's going to happen without your effort. You'll be better and better for 9 months to a year. I would like to rendezvous with you for the first 1-year anniversary. At that point, we'd like to get an x-ray and make sure everything looks good on x-ray, and make sure your hip replacement was a happy and successful endeavor. And assuming all's well at the 1-year visit, I recommend every other year x-ray. And we usually have a file system, and we'll send you a card every couple of years reminding you to come back and get an x-ray. There are occasionally some small things that can crop up on an x-ray that you wouldn't feel that would be wise for us to be aware of. That's really quite rare. If you don't keep those follow-up appointments, we don't chase you down, but it is a good idea, like a random dental check every once in a while to make sure that all is well. But I would expect that your hip replacement will last you many years. You've got about a 90% chance that you'll never have to have hip replacement surgery again. So call me if you need me, otherwise we'll see you at the 1-year visit. Thank you.